Hola a todos. Hi. Okay. I'm so sorry trying to stop someone to go in. Mm. Hello.
Hola, ¿cómo
Hola, ¿cómo estás?
estás?
Muy bien, ¿cómo estás tú?
Bien.
Bien, bien. Hi everyone. Hola a todos. So the first part of this live stream is going to be in Spanish. La primera parte de este live stream va a ser en español y el segundo va a ser en inglés. So yeah, y el tópico de este live stream es mi periodo y mi choice, my options basically. So do you want to start with some key points? So la primera cosa que voy a preguntar es la control de del qué es birth control.
So birth control es control de la natalidad. Usted con un útero puede decidir cuándo y cuántos niños o niñas que tiene y puede usar anticoncepción para obtener eso. Si no quiere 6 niños, puede solamente tener 2, o si quiere 12 niños, puede tenerlos también. Y si quieres más, no necesita anticoncepción. Pero birth control es para controlar cuántos niños, niñas que tienes y cuándo lo tienes, y puede tener relaciones sexuales sin tener un bebé cada vez que lo hace.
Sí. Y la segunda cosa que quería hablar es la sostenibilidad de periodo. So sustainability of like the period sustainability. So can you tell us a little bit more about that? ¿Lo puedes decir más de eso?
So, mucha gente, la gente con útero desde 12 años de edad hasta 50 años de edad usualmente tiene una menstruación cada mes. Y eso es 350 meses o 400 meses de una semana cada mes de menstruación on average. Y durante los primeros 2 años a veces es irregular, pero después del primer 2 años de su periodo, menstruación, debe de llegar cada mes, cada 28, 35 días. Si no lo tiene para 3 meses enseguida, visita a un doctor. Y la sostenibilidad es que usamos 10,000 o 30,000 productos menstruales en nuestra vida. So, para bajar eso, puede usar una taza de silicona en vez de las toallas o en vez de los tampones, o también hay braguitas menstruales que puede usar. And then al fin puede tomar la anticoncepción, no para anticoncepción, pero para parar su menstruación y solamente tener una sangración cada mes, cada 3 meses, cada 6 meses. Para mí, yo no lo he tenido una sangración para 13 años, desde mi última niña. Si yo tomo mis pastillas de anticoncepción cada día, yo no tengo una sangración una vez al mes.
So, ¿qué es lo bueno de no tener la sangración? ¿Qué los beneficios? Muchas mujeres o la gente que tiene un uteri se sienten como bien asustadas cuando no tienen su periodo. So, ¿qué usted puede decir a ellos, a esa gente que quiere no tener su periodo? Y si es los beneficios.
So, los beneficios de no tener una sangración cada mes, el primero es bajar su riesgo de cáncer de la matriz. So, eso es su matriz. y cada mes llena de sangración y material para sostener un embrión si un embrión ocurre. Pero no necesita hacer crecimiento y bajar, crecimiento y bajar, crecimiento y bajar cada mes, sino trata de tener un bebé. Y cada vez que ese crece, tiene riesgo de cáncer. También aquí a los ovarios, cada vez que un ovario sale, ¡pup, pup! Tiene riesgo de cáncer también. No sabemos si es el salir o es algo que ocurre en los tubos, pero cada vez que se crece, cada vez que se ¡pup, pup! Tiene riesgo de cáncer. También si alguien no tiene ese, crece bajo, crece bajo, crece bajo cada mes. También no tiene problemas con sus intestinos, porque 1 en 3 personas con úteros que tiene sangración tiene algo con su pupú, estreñimiento o diarrea. Y yo pienso es que los intestinos están alrededor de su matriz y por eso los hormonas crecen, bajan, crecen, bajan. Y los intestinos dicen, oh, yo soy triste para ti, yo soy simpática. Y por eso corre más rápido, diarrea, o corre más despacio. Y eso es estreñimiento. Y también si no tiene tantas sangraciones, 350 o 400 en su vida, baja sus riesgos de cáncer de la matriz, cáncer de los ovarios y cáncer de los intestinos. Y then el número 1 causa de anemia en una persona con un útero que tiene menstruación cada mes es menstruación. So, si quitamos la menstruación cada mes, tiene menos riesgo de anemia. So, si usted tiene mucho sangramiento cuando tiene su menstruación y siente un poquito, ¿cómo se dice? Menos energía, cansada, o más frío que usual, o aquí es menos roja y más blanca, indica no tiene suficiente sangre y eso indica anemia y debe ver su doctor. So, para prevenir anemia, quita de sangración cada mes.
Ok, muchas gracias, doctora Jen. Y quería seguir con las preguntas. Yo estaba leyendo algo del birth control y cómo funciona. Yo misma tengo unas preguntas y le quiero decir, ¿cómo puede profundizar más en lo que es las píldoras que son de placebo? So, the placebo pills. Can you talk more about it, how it works?
Yes. So aquí yo tengo muchas pastillas porque yo soy doctora y mi compañía hace píldoras, parches y anillos. So aquí es como yo uso mis paquetes de pastillas. Hay 3 semanas de un color y al fin de semana hay 2 que tienen hierro y eso es los placebos. Solamente tiene azúcar. Y esos no trabaja para nada. Eso es solamente no olvidas a tomar una pastilla cada día, porque si tomas una pastilla cada día y quita para una semana, tal vez olvides a empezar otra vez. Pero si ellos le dan esos placebos, recuerdas a tomar una pastilla cada día. Y cómo trabajan las pastillas en general es 3 semanas de hormona y después, al fin, esa semana blanca aquí, son placebo y las hormonas caen porque es solamente azúcar, no hay hormonas. Y cuando ese cae, indica a su matriz, tiene una sangración. So al día 2 o 3, depende, cada persona con útero es diferente. Usualmente al día 2 o 3 va a tener su sangración. Y cuando empieza su nueva paquete, al día 1 o 2, debe de quitar de cualquier menstruación que queda. Pero esa semana es artificial. Puede hacerlo cada mes, cada 3 meses, o puede ser una vez al año o nunca. Y las personas que inventan las pastillas, hay 3 personas. Una fue un doctor, fue católico, y 2 PhD, doctores de ciencia. Y los doctores de ciencia preguntan al doctor católico, ¿por qué quiere que las mujeres tienen una sangración cada mes? Puede ser cada 3 meses, cada 6 meses. Yo pienso si uno de esos tenía un útero, hay alguien que va a decir, yo no quiero los, por favor, no cada mes. Pero el doctor fue católico y él quiere que el papá de iglesia católica dice que puede usar las pastillas y las, how do you say nuns?
Las hermanas casi como
Las hermanas dicen sí, puede usar las pastillas. Y los, how do you say priests?
El padre, que no sé, el padre.
Los padres dicen sí, pero el papá más grande dice no. Y por eso todos los métodos tienen una semana cada mes, porque el doctor quiere que en la iglesia católica puede no tener relaciones cuando estás fértil. Y con eso puede hacer que solamente un riesgo de fértil en un pequeño parte de eso, pero en realidad ese hace que no hay fértil. Y si usa sus pastillas como las instrucciones, tiene muy bajo riesgo de tener un bebé, pero esa semana de placebo es demasiado largo. So puedes ver en los 9 pastillas solamente 4 días, porque el día 5 o 6 tiene riesgo de ovulación. Y si el ovario sale, tiene riesgo de embarazarse. So, por lo mínimo, yo sugiero a todas las personas que están usando, baja eso solamente 4 días de placebo. Pero a mí no me gusta sangración, so yo no. Yo tengo muchos paquetes sin la semana fin tomando. Solamente cuando yo llegue al fin, yo empiezo otra.
Okay. Está bien, muchas gracias otra vez. Y la otra pregunta que yo tengo es, ¿qué pasa si todavía no quiero usar ninguno anticonceptivos, pero quiero que mi periodo sea opcional? ¿Cuáles son algunos remedios caseros que puedo hacer?
So, sin el anticoncepción o otro tipo de anticoncepción.
Imagínate que soy todavía un poquito pequeña, como más 15 años, 16 años, y todavía no estoy como tan lista mentalmente para usar anticonceptivos. ¿Qué puedo hacer como remedios caseros, como like home, kind of like other remedies?
So, cuando eres más pequeña, sin medicina, debe de tener sus periodos o menstruación cada mes. Porque si no tiene su menstruación cada mes, indica el doctor que tal vez tiene algo en su tiroides o tiene, ha ganado mucho peso, han perdido mucho peso, o no estás comiendo suficiente, como están ejercicios o otra cosa. So, sin hormonas debe de tener un periodo cada mes. Con hormonas, los periodos son opcionales. So, no hay nada que puede hacer. Pero 2 años después de su primer sangración, ha obtenido su estatura final de adulto y puede empezar esas pastillas no para anticoncepción, right, you get that word right, anticoncepción, pero para hacer los periodos opcionales. Y yo he dado esa opción a mi niña. Ella tiene 16 años y lo está usando porque yo pregunto a todos los padres en Silicon Valley que son tigras madres, su niña va a hacer su SAT mejor sangrando o no sangrando, haciendo su deporte, sangrando o no sangrando, vayendo a escuela, sangrando o no sangrando. Y yo dice no sangrando, pero cada persona es su opción.
Sí, ok, gracias. Y otra pregunta también, ¿cuáles son algunas situaciones en las que no debías saltar tu periodo?
So, yo no puedo pensar ninguna razón de no saltar su periodo si están usando medicina para eso. Si no está en hormonas, debe de tener su sangración. Okay, so si no está en medicina, no ha tenido su sangración por 3 meses en seguido, vaya a un doctor, no es normal. Necesitamos buscar cáncer del cerebro, tiroides, algo con las calorías insuficientes, estás embarazada, pero la parte difícil es tal vez alguien no puede tomar las hormonas para parar la sangración cada mes. So, si alguien fume y está 35 años, los dos juntos, no solamente uno o dos, fume y 35 años, no puede tomar estrógena. Y si no toma estrógena, es más difícil parar la menstruación, pero hay métodos el divisio intrauterino que con hormona que puede parar menstruación en 30 o 70% de la gente que la usa.
Okay.
Actually 30% y la 70 es más leve. How do you say light?
Menos, un poquito menos. Yeah.
Menos menstruación. Y también el implante y también la inyección es solamente progesterona. Pero si alguien no puede tomar progesterona, then no podemos parar su hay otra que es muy caro, es una inyección y nadie tal vez va a darle porque es mucho.
Ok, gracias. ¿Y me puede decir cómo funciona saltarse el periodo? ¿Cómo me puedes decir más en depth cómo funciona cuando tú saltas tu periodo y cómo tu cuerpo como react?
Okay, so si estás usando las pastillas, sus hormonas están así. Y solamente cuando las hormonas caen es cuando tiene una sangración, no es menstruación. Y usualmente sin las pastillas, su matriz crece a un nivel 10 porque quiere un embrión y el embrión necesita crecer por 9 meses con esa sangre, ¿ok? Y más sangre que vas a darle y va a crecer. Pero con las pastillas solamente crece a un nivel 1 o 2. So, cuando caen las hormonas, ese 1 o 2 cae, pero es mucho menos sangre que alguien no está en las medicinas, el píldora, parche, anillo, implante, inyección o divisio intrauterino. ¿Cómo se siente su cuerpo cuando eso es? Las pastillas di a su cuerpo, hey, ella está embarazada, no necesita ovulación. No necesita crecer su matriz porque está embarazada. Las hormonas están en un nivel que dice, ella está embarazada, no hace nada. So eso es como siente su cuerpo cuando estás en esas medicinas.
Ok. ¿Y me puede profundizar más en por qué no puede tomar POP, píldoras de solo progesterona, para omitir su periodo, y qué otros métodos anticonceptivos no te ayudan o te ayudan a omitir?
Una buena pregunta. So, tenemos unos pacientes que no pueden tomar las pastillas con estrógena. Y me gustan las pastillas porque hay 40 diferentes pastillas. So, si uno no le gusta, hay 39 otros, o por lo mínimo hay 8 progesteronas. Y si no le gusta una progesterona, hay 7 diferentes progesteronas que puede hacer. Pero las personas que no pueden tomar la estrógena, es más difícil omitir los periodos y específicamente con la progesterona solamente píldoras, so the POP, las píldoras solo progesterona, porque cuando alguien tome eso, no sabemos cómo va. Tal vez va a tener sangración cada mes, tal vez solamente un poquito de sangración, tal vez más sangración. Cada persona es diferente que toma las píldoras de solo progesterona. Hay una nueva píldora de solo progesterona que se llama Slind y tal vez con eso tiene 4 días de placebo y los restos son progesterona y eso trabaja por más tiempo que el otro. El otro, si es tarde 3 horas de tomarlo, tiene riesgo de embarazarse. Con la nueva SLIND, no tiene ese riesgo dentro de 12 horas o tal vez un día. Yo pienso con eso, tal vez, si no tomes las 4 fines, tal vez puede omitir sus periodos, pero yo no sé.
Okay. Y tenemos una pregunta en el chat. Do you want me to tell you in English after I say in Spanish?
Yeah, sure.
Okay, so it's like, entonces, el control de la natalidad hace que alguien piense que está embarazada y por lo tanto no puede volver a quedar embarazada, ¿verdad? Do you understand that? What she said? What they said?
I got the first part, but I didn't get the second part.
Por lo tanto, no puedo volver a quedar embarazada. They said, so I can get pregnant again. Is that true?
So, yeah, no, nunca en nuestra historia de gente han tenido 2 bebés adentro de su útero de diferentes edades. Y eso es como trabajan las pastillas. Dice a su ovario, estoy embarazada, no omite otro, ovario para hacer otro bebé, porque no quiere 2 bebés de diferentes edades en su útero al mismo tiempo. Pero cuando quita la medicina, cuando cae las hormonas, tiene sangración y ese dice que la medicina ya de la cuerpo y puede embarazarse. So, cuando quita las píldoras, puede embarazarse dentro de un mes. You can get pregnant in a month.
Okay. Y también dijo, ¿y por qué se usa POP?
So, POP son las píldoras de solo progesterona. So, si alguien está 35 años de edad y fume cigarrillos o vape mucho, tiene riesgo a más coagulación de su sangre y por eso no queremos que esa persona toma estrógeno. So, si tiene contraindicación o razones de no tomar estrógeno, su única opción son las píldoras de progesterona o la inyección, implante o división intrauterino con cubre o solamente con hormonas. Pero esos son solamente progesterona, no hay estrógeno en el división intrauterino. So, otras personas son personas con lupus que tienen un antibody que hacen que más coagulación, o si usted ha tenido un ataque de corazón antes o un stroke de cerebro antes, algo como así.
Okay. Y también dice aquí que the birth control fakes the body to think it's pregnant. Is that right? That's
Sí.
all.
Sí,
Okay.
la medicina dice a su cuerpo, ella está embarazada, no hace nada más.
Ok, vamos a seguir yendo. Nos falta como 7 minutos más para la sección de español. Tengo unas preguntas más y después lo podemos cambiar a inglés. Ok. ¿Cuáles son algunos mitos que escuchaste acerca de la saltarse del periodo? Like, so what are some myths that you've heard about skipping your period?
Yeah. So, necesita tener el mito, es la necesidad de tener una menstruación cada mes. So, si está tomando las pastillas, solamente llena su matriz un poquito y no llena. So, alguien preocupe si no tiene menstruación cada mes con medicina, está creciendo. No, solamente un poquito, ¿ok? Pero sin medicina, sí. So, sin medicina, si alguien no tiene menstruación para 3 meses o más, tiene más riesgo de cáncer de la matriz. Y eso es algo que se llama el síndrome poliquísticos de los ovarios. En inglés es PCOS. Y puede Google nuestra blog sobre esto en Pendia Health si quieres más información sobre eso. Pero eso es un mito. Otro mito de saltarse es que la menstruación sale cosas malas y necesitamos salir cosas malas de nuestro cuerpo. Eso es un mito. No hay nada que necesita salir por su matriz cada mes que es malo o chemical o algo. No necesita cada mes hacer eso. No, puede hacerlo cada 6 meses, 9 meses. Lo que yo quiero dar información es que si vaya a un grupo de gente en África ahora que se llama el Dogon Tribe en África, ellas tienen solamente 100 menstruaciones en su vida y nosotros tenemos 305 o 400, suficiente para 3 otras mujeres. Y la razón para eso es empezamos nuestras menstruaciones a 12 años. Ellas empiezan a las 16 o 15, ¿ok? Y eso es porque tenemos tanta calorías en lo que comemos y cuando alguien llegue a 22% de gruesa o 100 libras, su cuerpo dice, hey, podemos hacer bebés. Entonces, en Estados Unidos, nuestro cuerpo dice, hey, podemos hacer bebés más temprano. El segundo más importante es que ella tiene 8 o 9 bebés en su vida. En los Estados Unidos, solamente 2 bebés en nuestra vida. ¿Y cuántas menstruaciones tiene cuando estás embarazada? 0. ¿Verdad? Y también ellas dan de pecho 12 o 18 meses. En los Estados Unidos, 0, 2, 3, tal vez 6 meses, pero solamente con 2 bebés. Y por eso ellas tienen 100 menstruaciones. Nosotros tenemos 350, 400 y lo más normal es tener menos menstruaciones.
Ok. Perdón, pensé que había una pregunta allá abajo. Entonces, tenemos 3 minutos. Si alguien tiene una pregunta en español o una pregunta generalmente, puede poner en el comentario abajo. Y una última pregunta en español que le voy a preguntar es, ¿cómo se puede usar el control de la natalidad para la planificación familiar?
Es muy importante no tener un bebé hasta que sus más pequeñita niño es 18 meses. Eso es lo que dice el WHO, que es una organización de salud del mundo. Y ellos quieren que su cuerpo tiene suficientes calorías para 9 bebés. So, debe de tener, no está embarazada, no hasta que sus más pequeña niña es 18 meses. Eso es para su cuerpo y para el nuevo bebé que va a llegar para tener suficiente nutrición de su cuerpo para tener un bebé perfecto. Y por eso, si va a tener relaciones desde 0 o un día hasta 18 meses de su nuevo niña y necesita usar el anticoncepción.
Okay. Y una pregunta más de eso. Vamos a decir, eso no afecta nada cuando una persona que le da, como una mamá le da a su niño la leche, no le afecta nada la leche y cosas así para el bebé.
Eso es buena pregunta y es sobre las píldoras de solo progesterona. Lo que es con estrógena afecta la leche que hace la mamá que pare a veces si no han dando de pecho más que 6 meses. Si han dando de pecho más que 6 meses, puede usar las píldoras con estrógena, pero antes de eso tal vez puede pararlo con estrógena. Y a veces las personas empiezan las píldoras para parar el sale de leche. Pero si quiere dar pecho de su niño, por favor no usa las píldoras con estrógena antes de 6 meses de edad de su niño.
Okay, gracias. Okay, so we're gonna switch over to the English part of this section. Hi everyone, my name is Erica. I'm doing a live stream with Dr. Yen. Here she goes. This week's or this month's, my bad, live stream is My Period, My Choice. Hashtag periods optional, and we're gonna have some questions and overall, anyone who has any questions could put it down in the comment below. We'll be happy. I mean, Dr. Yen is happy to talk to you about it and just like answer any questions you guys have. And we're gonna start with the points to mention, just like key points. So overall, what is birth control?
So birth control is something you use to prevent pregnancy. And usually when people say birth control, they're thinking the birth control pill, patch, ring, but also know that there's the implant, the IUD, there's permanent birth control, vasectomy, tubal ligation, there's the injection, and then there's condoms, always condoms. We have the condom bag. And know that we have it for sale now. So if you want a condom bag, it's $65. We'll drop it in the notes later, but $65.
Just keep talking for sure.
Yes.
They'll be like, oh my god, cool, condom bag.
Yes. And I've had lots of comments, met lots of people in airports, planes, bathrooms, concerts, wherever. It just opens the door to say, let's talk birth control.
Yes, very much. Okay, so what's hashtag periods optional? What is that all about?
So I'm an adolescent medicine specialist, but also I'm a person with a uterus. And in trying to get pregnant, I realized the only reason that those of us with uteruses bleed every month is because we didn't get pregnant. The only reason that we build that lining up every single month is to be like, hey, is there an embryo? Oh, okay, no embryo. And then we bleed it out. And then we build it up. Embryo? Oh, no embryo. And then we bleed it out. And every time we grow that lining, we risk endometrial cancer. Every time we pop out the egg, and we don't know if it's the popping or the healing or the something in the tubes. I think it's something in the tubes, what I heard. That increases our chance of ovarian cancer. So if you ask any smart doctor, how can I decrease my risk of ovarian cancer? If you go on the pill, patch, or ring for 5 years and stop that popping out every single month, you decrease your risk of ovarian cancer by 50%. And then lastly, your intestines surround your uterus. And so while your uterus is like up and down, up and down, up and down, the intestine's like, I'm sorry, that's sad for you. And so the intestine will either run faster and then you get diarrhea, or it runs slower and you get constipation. And so I just want to bring that up because 30% of us with uteri get either diarrhea or constipation, and hashtag stop sucking it up. Let's all suffer together and complain about it. And so that increases your risk of colorectal cancer, because anytime you slow things down or speed things up, then you increase your risk of cancer. And so I realized that we can make periods optional. And I learned from Malcolm Gladwell, who some of you all may know. He had an article in the New Yorker, as well as in the Annals of Internal Medicine, which is like a serious medical journal. And he wrote about the founders of the pill. So if you'll notice, every pill usually has 3 weeks of active pills, sometimes all the same colors, sometimes different colors. And then the last week is a sugar pill. And the 3 weeks, we prefer all of the same color. There really is no reason to go up and down on those because it's so super physiologic. And why go up and down when you can be nice and smooth? But the founders of the pill were 3 dudes. One was an MD and 2 were PhDs. And the 2 PhDs are like, why are you making women bleed every month? It could totally be like every 3 months, every 6 months, whatever you want. And I'm sure that if one of them had a uterus, they would have been like, please give women the option or the choice to bleed whenever they want. Don't make it every month. But Dr. John Rock was a devout Catholic, and he wanted to get this through the Catholic Church. And the Catholic Church allows you not to have sex on your fertile days. So he's like, if I can make the period come every single month, 3 weeks, bleed, 3 weeks, bleed. And then you would know when your fertile days were, and then you could skip it. And he got it through the nuns. Yay! Mm-hmm. He got it through the priests. Yay! It hit the Pope. Boo! And because of that, every method since has had this 1 week of arbitrary bleed. You can take this every month. You could do this every 3 months. I haven't had a bleed since my last child, which was 13 years ago, as long as I take my pills every single day. But if I miss a couple, then there will be blood. The other thing I do want to put out there is that most of these newer ones only have 4 days of placebo instead of 7 days of placebo. And the reason why is they've actually shown in research the 7 days of placebo was in the old days when we had 110 micrograms of estrogen. We are now down to 30, 35, and in some pills down to 20. We don't recommend 20 at Pendia Health unless you're over the age of 30, because too low of estrogen is bad for your bones, particularly for Asians, Latinas, and Blacks who are lactose intolerant, or for people who just don't like milk. Okay. So so this was assuming you were on a really high dose of estrogen. Now that we're on lower dose of estrogen, they've actually shown on day 5 or 6 of these fake pills that there's a risk of ovulation. And if the egg pops out, then you risk pregnancy. So I suggest if you're gonna bleed every month, take it down to just 4 days. Don't do the whole 7 days and just go straight into your next pack. But I say, why have any periods? And so I came up with #periods optional.
As you should. Thank you so much. And one more thing is, so compare period frequency to back then and how it is now, to understand why it's beneficial that period should be less frequent now.
Yes. So what it is if you, part of Malcolm Gladwell's article is he covered the work of Dr. Beverly Strassman. She's an anthropologist and she studies the Dogon tribe in Africa. And they die the same time we do. So we're not comparing people who die at 30, but we're comparing people who die at 70, 80 with us, 70 or 80. And they have 100 periods in their lives. We have 350 to 400. What? We have enough for 2 or 3 other women, and that's not cool. I don't like the blood. And so how does that happen? What it is we get our periods at 12. They get their periods at 15, 16. The reason why is once you hit 22% body fat or 100 pounds, your body's like, hey, you're ready to make babies. You have enough body and energy to support a baby, so let's make babies. And so we start earlier. They, more importantly, have 7 or 8 babies in their lives. How many babies do we have on average in the United States? 2. And so how many periods do you have when you're pregnant with 8 or 9 babies? 0. So that's why they have far fewer periods. The other thing is they breastfeed for 12 or 18 months. How many periods do you have when you exclusively breastfeed? 0. We breastfeed for 0, 3, or 6 months. And so that's the difference. And so it's actually natural to have fewer periods than what we are having now. And the more up and down, pop and pop, blah, 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 is more cancer that we're having.
Okay, thank you. So how does birth control help someone skip their period? Like, how can you go more in depth and how it all works, like how to make the period optional?
Yes. So the way the birth control pill works is it's 3 weeks of hormone and then 1 week of sugar pill. And when you hit that sugar pill, your hormones drop. And it's that drop that triggers the shedding of the lining of the uterus. And so you can do that, as I mentioned, once a month, once every 3 months. There's packs of pills that do that, but you don't have to use the pack of pills. You can just take a normal pack and skip the last week and go to the next one, or once a year. And the way it works, birth control in general, is it tells your eggs, hey, she's pregnant. Don't pop out any eggs. It also thins the lining of your uterus so that if an egg and sperm were to hook up, it's not thick enough to grow an embryo for 9 months. But the main mechanism is it tells your body you're pregnant, so you don't need to pop out any eggs. And the reason why it's important that if you're pregnant, you don't pop out another egg is because never in the history of humans have we had 2 babies in a uterus at different ages. Because one egg would have had to pop out and then sperm would have had to get through. And actually, once you have an embryo growing, it protects this because it doesn't want sperm coming in and doing other stuff.
Okay. And can you go more in depth about, I know we talked about this before, the placebo pills. I remember reading a little bit about it. I'm a little confused and I don't really understand how they work. So can you go more in depth?
The whole point of the placebo pills is just so you don't forget to take a pill every day. Because you can imagine if you take a pill every single day for 3 weeks and then whole week you don't go, you like forget, and then you might not start your next pill. And that's really dangerous. The most dangerous increased risk of pregnancy is extending the 7 days. Because we already said day 5 and 6, the egg could pop out. Day 7, an egg will definitely pop out. And so that's why they have these placeholder pills to let you remember. There are some packs that are just 3 weeks and they're like, good luck with it, remember, good, no. But this is why those sugar pills are there. But you don't necessarily have to take them. Back in the day, I made my significant other take them because I was like, if I have to take a pill these 3 weeks, you have to take a pill last week, just so 1 week out of 4. You know what it has to take a pill every single day just to protect us from not getting pregnant when we don't want to get pregnant.
Thank you so much for explaining that. And what are some myths that you always hear about skipping your period that you want to debunk right now?
The number one myth that I've heard about skipping your periods is that you have to bleed every single month. Otherwise, there's some dark humor or tumor badness in your uterus that if you don't clean it out, it'll like give you cancer or make you die or something like that. And I think part of that is true in that if you're not on any hormones and you haven't had a period for 3 months, then yes, the lining of your uterus is growing uncontrollably, and therefore you are at risk of cancer. But it's not that the bleeding is letting out bad stuff. It's just you don't want this uncontrolled growth in your uterus leading to cancer. And it's not that there's like dark humors in our uterus or our blood that we have to let free in that flow every month. You don't need that. It's not true. The only thing that comes out is the blood and the tissue that grew saying, hey, is there an embryo? And if you're not trying to catch an embryo, which a lot of us aren't or didn't until, 26 on average in the United States, or 35 for those of us who had more school or took a while to find the love of our life, then why would you bleed every single month from age 12 to 26 or 12 to 35? And then once you pop out 2 kids, which I did, why would you bleed on the other side to 50 every single month? Like, why?
Yeah. I was gonna say, definitely I understand like the struggles of like having your period, and I'm like, it makes no sense of why having your period, and then like you're not even planning to have any kids right now, so very understandable. And getting into like planning to have kids, how can you use birth control for family planning?
So, what the WHO, the World Health Organization, recommends you don't get pregnant with another baby, not pop out another baby, but get pregnant with another baby until your youngest is 18 months. And that's to give the person with the uterus's body time to get all the nutrients and all that stuff and make your womb all happy to accept a new baby, a new embryo. If you do it sooner, then that's not optimal. So they're trying to optimize your nutrition and the future baby's nutrition that they can get from you. And it's not pop out the next baby 18 months. So you want it, your next baby will come out when the other one is not 27 months. So that's like 2.5. You don't want to pop out another baby till your youngest is 2.5. You don't want to get pregnant until your youngest is 18 months. And so if you're going to have sex from when you have a baby, which some people wait a month or 2 because, or even more, because who has time to have sex when you have a new baby? But definitely sex, hopefully by 18 months. If you want the optimal timing between children, you're going to need some birth control. Yeah. So the pill, the patch, the ring, IUD, implant, shot. Probably not the implant or the IUD because those are more long-term. The shot is also unpredictable when you're trying to come off. Sometimes it can take up to 8 or 9 months to get back your fertility if you really want to pop out your kids quickly. So you probably go on the pill patch ring if you're in between kids, spacing them out.
Okay, and also like continue with the family, and now getting pregnant after your first kid, like being 18 months. What are like some people are scared to take birth control because it may affect like their breast milk or anything like that. So what can you say to those people? Like what concerns can you talk about?
Yes. So great question. There are these pills that are called progesterone only pills, and they're called that because there's no estrogen. The normal birth control pills have both estrogen and progesterone. The progesterone pills are just all one thing, 28 days, all the same thing. Though there's a new one that has 24 days, one thing, and 4 days sugar pill. But the estrogen containing ones, if you're breastfeeding, can affect your breast milk production. If you have established breastfeeding for 6 months, then it's fine to use an estrogen pill because you've established it and you're probably weaning as it is at 6 months. And so it's okay to use the estrogen. But until 6 months, if you're breastfeeding, we recommend only the progesterone only pills to support your breastfeeding. But if you're not breastfeeding, then you can take whatever you want. But if you are breastfeeding, then we don't recommend any estrogen containing until 6 months out. And then a lot of people say, does birth control make me sterile? And my joke is, yeah, while you're on it, that's why you're taking it. But when you come off it, the way you know it's out of your body is, like I said, there's 3 weeks hormone and then 1 week sugar. And by day 2, 3, or 4, when that hormone drops, you bleed because the hormones have left the body, and that's the signal for your body to leave. So usually if you stop birth control, within 2 weeks, you're ready to go and have another baby.
Interesting. So why are some wait, how can you give some advice to people with iron deficiency? How is their period affecting their iron deficiency, and how can birth control help them overcome that?
Yes. So the number one cause of iron deficiency and anemia in a menstruating woman, this is a question we ask medical students as professors, what's the number one cause of anemia and iron deficiency in a menstruating woman? And I give you the answer: menstruation. Because bleeding every single month is not natural. We were supposed to be pregnant or breastfeeding. And when you're pregnant, 0 periods. When you're exclusively breastfeeding, 0 periods. It's this artificial not having babies, not saying we should have 8 or 9 babies, but it's the artificial not having babies where we're bleeding every single month. And actually, as an adolescent medicine specialist, we see in adolescents, those with penises, their hemoglobin or indicator of anemia goes up, and our hemoglobin goes down. And I think it's because we bleed every single month. And if we didn't bleed every single month, it should stay, or at least, go up. And that is the number one cause of iron deficiency and anemia. So if you're feeling cold, tired, feel your heart beating really fast, and you have heavy periods, please see a doctor. You could have anemia. And then specifically with iron deficiency, I'm all about like hacking life with the best drugs possible, illegal drugs. And they've shown, we took a whole bunch of young people, boys and girls, who didn't have anemia, because as doctors, we usually check for anemia. And then if you have anemia, we check for iron deficiency. But they excluded the people with anemia. They took people who didn't have anemia. Then they checked for iron deficiency. And when they checked for iron deficiency and they gave them iron, those people with uteri did better in math and did better with IQ tests. And so if we are constantly being bloodlet, and I like to take the imagery, just take my arm and go and bleed for 1 week out of 4, right? If we're being bloodlet every single month, imagine if we had iron and we could, be better and we could do math. And I'm not saying women are stupider, because women are smart. And I love to say as a feminist, I can do anything you do bleeding. But as a doctor, why do I have to? And so we may, as women, be handicapping ourselves with respect to math and tests and competitive sports, where you need that extra oxygen burst. So if you're doing sprinting or something, bicycling, then don't bleed every month. But don't waste that blood. And that is my tip to all the sports people. They just did a piece on tennis and soccer, and how one of them is now allowed to wear dark shorts, because before they could only wear white shorts for all their stuff. And can you imagine 1 week out of 4? And so I say go #periods optional, because you need the blood to run around. And then why bleed and worry about bleeding in the middle of your international competition?
Understandable. White shorts is very scary. Nobody likes to wear white when they're under period.
Or anywhere near your period.
No. So also, if I skip my period without being on birth control, is that normal? And when should I start getting concerned?
Yes. So really important that we can make #periods optional with hormonal medication. But if you are not on anything and you're not within 2 years of your first period, because I know a bunch of 12-year-olds will ask, they're like, I'm 12, I haven't had my period. It's totally fine for your period to be whack for the first 2 years after you get your period. However, if it comes every single month and then it goes away for 3 months in a row after that first 2 years, see a doctor. It could be a brain tumor. It could be thyroid problem. It could be anorexia. It could be you gained a whole bunch of weight. You lost a whole bunch of weight. We need to find out why. So if you're not on hormones, birth control pill, patch, ring, IUD, implant, or shots, then you do need to have a period every single month. And it's not because you need to bleed, but it's because that's a measure of, is anything else going on with nutrition, thyroid, brain, weight gain, weight loss.
Yes. So just want to let the audience know we have 10 minutes left. So if you have any questions, someone in the comments says I tried to do period optional with my supply of birth control, but the first time it didn't work. Then I just ran out of birth control. So what can they do?
Two things there. Number one, know that there are 40 different birth control pills out there. So if one of them doesn't work, you got 39 others to try. But more importantly, know that there's 8 different progesterones. And some of them are more likely to bleed, some of them are less likely to bleed. And each person is different. I've actually found that people of Asian and Black descent are more likely to bleed. And so what we were taught at the major academic institutions doesn't work for people of Asian and Black descent. We need a touch more, don't bleed progesterone. And so at Pandia Health, we've trained all of our doctors how to maximize the best birth control based on your age, your body mass index, and race as a proxy for genetics. In the future, we're going to collab with a genetics company. And if you give us your 23andMe, we'll be like, oh, you got this genetics, this is the best birth control for you.
That's cool.
So number one, you might need a stronger progesterone. You might be of Asian or Black descent, or there might be a touch of Asian in your Black that you don't know about, but whatever. And then the second one is you ran out. You ran out because you didn't tell your doctor you're doing this. If you tell your doctor you're doing this, they'll write, okay, to skip placebo and make sure you get 17 packs a year versus the standard 13 packs. Because if you're skipping this last one, you're going to need, an extra 1 week out of every 4 weeks. So if you're skipping, you need 17 packs a year. And if you're not skipping, it's 13 packs a year. And then if your doctor, has to fight with insurance company, they can write menstrual suppression or they can write dysmenorrhea. I define dysmenorrhea as don't like, menorrhea, bleed. And if you're asking to skip your bleed, you're dysmenorrhea. But some people say that dysmenorrhea has to be painful periods. So if your periods are painful, and any blood loss to me is painful, and you can just say dysmenorrhea and your insurance should cover it. And then you can also argue that this 7-day withdrawal puts you at greater risk of pregnancy. And if you get pregnant, you're going to sue them. That scares the insurance company. And so you can say Dr. Yen of Stanford said it's better to have only 4 days, if any. And they've actually shown in heavier people, the fewer the placebo days, the better. So get your doctor to write, okay, to skip placebo, make sure they give you enough birth control. There are actually 20 states where they're required to give you a year's supply of birth control if your doctor writes it. So you just got to ask your doctor to write 13 packs, 17 packs, and say, Dr. Yen from Stanford said that's fine. And it's educating doctors, because I didn't know about this till I opened a pharmacy. I was like, I gave you a year's supply, dispense one, refill times 12, but I didn't realize the pharmacist can make the prescription smaller, 13 packs, 17 packs, whatever, according to what your insurance wants to pay or if you're paying cash, but they can't expand it. So if I write dispense one, refill times 12, I've chained you to that pharmacy every single month. So make sure you educate your doctor. It's fine to write 13 packs at a time or 17 packs. And actually, the latest recommendations is write 13 packs at a time.
Okay, thank you. That's so much good. I didn't even know that. Thank you so much. And if anyone we have 6 minutes left. If anyone has any more questions or wants to just make any comments, we're very open to it. So I was gonna say, what are some situations when you shouldn't be skipping your period? Do you believe there are any?
Yeah. So if you're not on any hormones, then you shouldn't be skipping periods, because then we got to look for tumor, thyroid, pregnancy. I forgot pregnancy, if you're still active, or eating disorder, losing weight, gaining weight too much, or something else messing it up. But Other than that, I don't understand why you shouldn't make periods optional. Again, it's more natural for us to only have 100 periods in our lives versus having 350 to 400. The main thing would be if you had a contraindication to the medication. So if you are a person who's 35 and a smoker, then no estrogen for you, because the estrogen makes you clot, and because you're a smoker and 35, you have a greater risk of blood clots, and the risk outweigh the benefits. You can use progesterone only methods such as the IUD, the implant, or shot, but the IUD and the implant, I believe, only 30% of the time do you get no periods, but 70% you get lighter. And then with the shot, I believe after 3 shots, 75% of the people don't have periods. But the negative on the shot is if you're heavier, you gain weight. It gives you the munchies. And then if you're lighter, it's not good for your bones. But anything is better than pregnant. So it's a risk-benefit ratio whenever you're considering these kinds of things.
And someone, the same person again, she was like, my niece got prescribed birth control because she didn't get her period, I think, till she was 21. That was confusing.
Yeah, so there's 2 possible reasons for that. One is polycystic ovarian syndrome. So polycystic ovarian syndrome affects 1 in 10 women. And what it is every month in our egg, like 5 eggs or 10, I don't remember the exact number, it varies obviously per person, come and grow. And the one that gets the most estrogen wins. The others get sucked up and die. And then it pops out. But with polycystic ovarian syndrome, because the hormones are messed up, nobody wins and nobody pops out. And so there's just all these cysts that are happening on your ovary, and that's why it's called polycystic. Normally there's just 1 cyst a month that pops out, but this one has a whole bunch that are stuck there, and we call it a ring of pearls. On an ultrasound, it looks like a ring of pearls. It's pretty cool. But that might be what she had. Most likely 1 in 10 women have that, and they don't get the symptoms of it is they don't have a period for 3 months in a row. They have hairiness, they have acne. Part of that sounds like teenage life, except for the no periods for 3 months in a row. And the treatment for that is birth control pills. And if it were me, my friend, my patient, and metformin. So if you see an endocrinologist, they'll be like, metformin. If you see an OB-GYN, they'll be like, birth control. But the research has shown if you do the 2 together, it's better. Because there's the metformin treats the metabolic badness, which is high insulin levels, increased risk of diabetes, bad cholesterol and whatnot. And then the birth control treats the no period for 3 months. And so people think that the point is to give you a period. The point is that in people in polycystic ovarian syndrome, because it doesn't pop, it's the popping, and then it turns into this thing and it secretes progesterone. And so without progesterone, the lining of the uterus is growing. With progesterone, just sits there. Let's start with the birth control pills, just level 2, but without growing, and risk of endometrial cancer. So it's hard for me to explain to my patients on PCOS. I'm putting you on this because you aren't having a period every month. But once you're on this, you don't have to have a period every month. So that's like complicated.
Yeah.
But most doctors like just bleed every single month on PCOS, but really, if you don't have to bleed. You could bleed every 3 months, every 4 months, or never if you're on the birth control pill, patch ring, IUD, implant, or shot. And more people are getting used to that because more people, thanks to Trump, but also just better birth control, are on implant and IUD because they're like, I do not want to get pregnant. I cannot get pregnant. It's a very bad situation in this country right now. So the implant is amazing, very effective. The IUD is the second most effective. The only negative is they both only have 1 hormone. And if your body doesn't like that hormone, then that's not the option for you. But for a lot of people, it's amazing. I like the pill because there's 40 different options and 8 different progesterones. And so if one doesn't work, I'm pretty sure I can find one that works for you to make #periods optional.
Yeah. Is there any last comment that you want to make? We have like a minute left. Yeah, we do.
If you guys want to learn more about periods optional, I'm going to drop in the chat the link to our website on the topic. And at the bottom is my TEDx talk on making periods optional. So it's a rehash of what we just did now, if any of you guys want that.
Yeah.
But without the cool questions and without Erica.
Thank you so much. It was I learned so much just like listening to you, and thank you so much for like basically just fighting for us and like making hashtag periods optional. So thank you for Dr. Yen for tuning in today, and we'll see you next month for TMI Tuesday. All right, I'll see you. Bye bye.
Thank